Okay. Okay, so your condition's got worse since the last call was made, is that correct? Right.
Call handler Pam is dealing with a young, panicked patient. This is the second call this patient has made today.
Right. Okay, so how old are you? You're 16, okay. She came on the phone saying that, I think I'm going to die, you need to help me now. She felt like that her heart was racing, that she was maybe having a heart attack. Right, okay, you just listen to me. This time I'm going to stay on the line with you, okay, until the ambulance is right there. But I do need to ask you some things as well, okay? Do you have difficulty breathing or swallowing? You do both of that, okay. And have you ever had a severe allergic reaction to the same or similar thing before? Okay, okay, okay. And do you have any specific injections or other medicines to treat this type of reaction? You don't, okay. If it is the same caller that's called the second time round, the condition has changed, so we go through the call again. So then the call is reassessed again, and if it's appropriate, then it would be upgraded to a higher response. That's not always what happens, but in this case it was. Okay. Right, okay, so I'm organising help for you now. Stay on the line. I'll tell you exactly what to do next. Right, okay, so you just continue to focus on your breathing, take slow, deep breaths, okay? And I'm going to stay on the line with you until they're there, okay? Okay, listen, I can't give you an exact time, but I can assure you that the quickest ambulance is coming to you. Okay, it's a high response ambulance you're getting, and we are coming to you as quickly as we can, okay? We just cannot tell any caller that calls that the ambulance is on the way, because an ambulance could be allocated, but then there could be a cardiac arrest in the same area, which then those crews would then be diverted to that because it's a higher priority response. No, I'm going to stay right here with you until they're there, okay? You're doing really well. I know, I understand. It must be very frightening for you. Okay, you just take slow, deep breaths, okay? If you raise your voice, that's going to panic somebody even more. So we use a skill which they call repetitive persistence, which means that we talk in the same tone and sometimes having to repeat things over. It does take a little bit to learn it to start with, but it's a skill that does work. And I know how frightening it must be for you, but try your best to just take slow, deep breaths in and out. You're doing really well though. Well done. Okay, you just stay awake, okay? You can keep speaking to me. No, you just stay sitting down. You said that you're feeling faint, okay? So just sit down, okay? Okay, okay. There's a protocol that we follow which means that it does become our highest response ambulance. A purple response, which would have been sent to her. So I just stayed on the call with her until I could hear the ambulance crew there with her taking over. Oh, that's great. Okay, I'll just stay on the phone with you until they're right beside you though, okay? Are they in the house with you now? Okay. Right, that's fine. I'll leave you with the crew then, okay? You take care. Okay, bye now. Bye. It's just such a rewarding job. I know that it can be stressful at times, but it's very rewarding. Yeah, it's something that I just love doing, and I just love the job as an emergency call handler.